Hey guys, I hope you're doing well. I just wanted to take a few minutes and review the termination process in terms of group therapy. Now, there are a lot of excellent resources on the internet in terms of different programs and different ways to go about termination, identifying what termination is, and so forth. One of the really cool resources that I'm going to be using is actually from the Masters of Science Counseling program from Syracuse University. On their website, they've got a really nice structured way in terms of what termination is, the purpose of termination, good ways to go about doing it, and so forth. So I'm just going to pull that website up and review the process of moving towards termination in terms of group therapy. So again, termination is really the final stage of the counseling process. And it's something that we want to do ideally when particular goals and objectives have been mutually agreed upon in terms of the counselor and the client, and most importantly, have been achieved. Sometimes termination of the group process or even individual therapy doesn't necessarily always have to happen only when goals and objectives have been achieved. Sometimes we may be terminating that particular relationship for a wide variety of variables. Perhaps in a job change, the particular client may be moving on in terms of a different area, change of insurances, or maybe it just simply wasn't a good fit in terms of that therapeutic relationship. Or even, we're moving that particular individual on to other community resources to better address what is going on in terms of that. Rule of thumb, before I even really dive into some of the excellent resources on the Syracuse University website, is the idea of termination is not something that you really want to just drop on your client. It's something that you want to build towards. It's something that you want the client to be aware, or the group to be aware, that is coming. So it's something that you want to engage that group in, something you want to engage that particular client in, and something that you want to build towards that final meeting. So again, I really, really want to stress that. That's a very common mistake that a lot of new clinicians, group leaders, even seasoned clinicians do. You want to make sure that you put enough time so that particular person can process the termination of that group or individual therapy. So some helpful guidelines for effectively moving your clients or group towards termination. Again, constantly reminding or bringing up the topic of approaching the ending of sessions. When or what is a good number in terms of that? It really depends upon your relationship, your group, your particular client. Rule of thumb, right around 2 to 3 sessions prior to that final one is when you want to start talking and processing the end of that particular relationship. And again, that also depends upon if you and that group or that individual have an open number of sessions, or maybe in particular situations, you may actually be only allowed a certain amount of sessions. So you want to make sure that you really space out and leave for that good process. Another thing that you want to be very mindful of is reviewing the progress that particular client or that group made during their sessions leading up. Very often, clients will forget or neglect, or another thing that tends to be very common is simply just anxiety of ending that particular relationship. So the client or group sometimes feels as if they cannot move on, or that the therapist or leader is needed. Well, we need to remind them that they have accomplished particular goals and they have contributed to their own success and so forth. We need to make sure that we include our clients or our group in terms of their feelings and their emotions surrounding termination. Again, many will have different types of emotions. Some will feel very anxious. Some will feel very sad. Some will lash out at you in terms of that particular situation. And again, some groups or individuals may be completely fine in terms of this particular termination process. Also, another thing that I really emphasize with a lot of my students is that you need to be very aware of your own feelings, your own insights surrounding the termination process. Is it normal for you to feel certain emotions? Obviously, yes. You have been in this very therapeutic, very intimate setting with these individuals. How are you going to address that? How are you going to move forward in terms of ending that group process with those individuals or that particular person? Another thing you want to be aware of is once termination has happened, where or what are you going to do in terms of the individuals within that group or that particular person? Will there be an open door policy? Will those individuals be allowed to check in every so often? Or is it the end of that relationship moving forward? And again, very important things that you want to address or plan for in terms of your termination process. Now, there are many different types of termination. And again, how you go about addressing termination within your group will be not manipulated, but will be facilitated or kind of geared around the types of termination which you may have. One particular type of termination is what we call forced to terminate or forced termination. The thing that really pops up in my mind is, in clinical settings within the community, because of insurance reasons or whatever, or even EAP settings, we're only allowed a certain amount of sessions. So that termination is forced. And one of the things that obviously you want to make sure of and anticipated reactions is that we make sure that that particular client or group doesn't feel abandoned, that we make sure that we address their needs in terms of community referral or other resources that they may take advantage of in terms of that. Again, we also have to not only be aware of those particular clients or the group, but how are we going to experience that forced termination, so to speak? Guilt is a very common emotion for many counselors to feel in terms of forced termination. And again, it's something that we really want to make sure that we address. Client initiated termination, again, can occur in a number of different situations. Just like the name says, this is pretty much when a client may initiate termination when they feel that they've accomplished particular goals or objectives or so forth, or maybe they simply just haven't adequately met them, but they feel that they need to end that relationship for whatever it may be. Again, anticipated reactions, clients may initiate termination of the relationship if they do not feel comfortable with that particular counselor. In some cases, counselors often feel a sense of insecurity, ability to effectively connect with counseling clients, guilt, things along those lines. Again, we need to make sure that we're demonstrating best practice, meeting the needs of that particular client, and at the same time, being aware of our own insight. Counselor initiated termination. Again, this could happen for a variety of different reasons. The most often that really pops up to my mind is that, again, any good counselor is aware of whether that particular individual is meeting their goals, meeting their objectives, and even more importantly, that counselor needs to be aware of if they are a good fit. Does that particular client or group fit within their particular scope of practice? So sometimes, simply just based upon our own ethical duty, we need to be able to address that and we may need to terminate in terms of that particular relationship. Some of the things that group leaders can do to increase the chances of ending a group successfully. Again, very, very important, reinforcing the progress that was made during the group or during the course of that particular group. So again, we want to anticipate. We want to anticipate crisis. We want to anticipate anxiety. We want to anticipate anger, doubt from our group and our clients. And it's very important that within those last 2 or 3 sessions, we review those particular skills and concepts that our group has worked on so very, very well. Even more importantly, and I think this is a huge thing that a lot of clinicians forget, It's not only important that we reinforce the progress and we reinforce the skills in which they learned, but we make sure that that particular group and those individuals are able to apply it. So, for example, okay, what are some anxiety management tips you or skills you guys have learned? They rip them off with no problem. Okay, can you give me an example of how you would apply that in this particular situation or this particular situation? So we want to make sure that that application is there. Other things we can do, offering suggestions to group members about ways in which they can successfully, again, incorporate those skills, helping group participants brainstorm, anticipate problems that may arise when that particular group has concluded, allowing time for constructive feedback from group members, again, going back to processing the feelings in terms of termination, educating participants about additional resources, and really making oneself available should the need for individual or consultation group members arise. So we want to make sure that, and when a group ends, that even after that termination, there are alternate resources, there are community resources, there are social media resources for those individuals to take advantage of. Tips for successful termination, again, discussing termination with your clients, establishing clear goals, keeping your relationship very professional and making sure that we're maintaining those ethical boundaries and confidentiality, helping clients again review the success, and most importantly, allowing clients to discuss feelings of loss surrounding that termination. So here are some sample feedback questions that often we want to kind of put out in terms of our group members, in terms of our individual clients, to kind of get a sense of kind of where they're at, how was the group for them, and so forth. So sample feedback. For an example, I may put something together, for example, for each of the statements below, circle the option never, sometimes, usually, or always that is closest to how you feel. So number one, I feel like Bob really listens to me and understands what I'm saying. Or I feel comfortable and safe when I meet with whoever, I feel like she cares. And again, this is a nice way to get feedback from your clients in terms of the group process. And again, what is it that they got out of in terms of that? So we want to have a nice evaluation method in terms of that. Very often I get students who ask me, is it okay to accept gifts? Is it okay to give gifts? Is it okay to hug? Clients who are leaving? Is it okay to give out personal information? Is it okay? Again, and we need to make sure that we fall back on our ethical principles and confidentiality in terms of those particular things. In terms of my experience, okay, again, it really depends upon the social context and it depends upon the type of relationship in which you have with those particular group members and with that particular individual client. Have I ever accepted gifts or parting gifts from clients? Yes, obviously, depending upon what it is. Okay. So, for example, I had a woman who was in a group therapy setting with me, and she was with us for at least over a year. And she actually knitted a very nice blanket. And when she graduated our program, she gave it to me as a thank you. Now, with that said, okay, again, making sure boundaries, ethical guidelines, confidentiality, things like that are being met. So that relationship was ended. Thank you. I appreciate the gift. You kind of move on in terms of that. Is it okay to give clients gifts? Things such as like a certificate or of maybe hosting like a pizza party or something along those lines. Again, we want to make sure that we're following into to lead in terms of policy and procedures and the organizations and agencies that we work with. But things like that really shouldn't be an issue. I think where it becomes an issue is when we start exchanging phone numbers, emails, maintaining contact, things like that, I think become a problem. All right. So those are just some basics in terms of the termination process, things that we need to be aware of, the different types of termination. And again, the thing that I really want to emphasize the most, and I'm kind of beating a dead horse here, is with termination, we want to make sure that we start it with a good amount of time to make sure that not only you and the group and the individuals can process the ending of this therapeutic relationship. And on top of that, we want to make sure that we refer and give out as much educational information and referral information as we possibly can to know that these individuals are still supported within the community moving on. All right, so hopefully that gives you a really good idea or a better idea in terms of the termination process. As always, if you have any questions, feel free to reach out and shoot me an email. All right, thanks, guys.